US Defense Secretary Pete Hegseth has announced troops over 30 will be screened for testosterone deficiency. The program has drawn criticism from Democratic politicians, one of whom said it proved Hegseth was taking cues from the far corners of the manosphere. The Pentagon says the policy aims to address the rigours of the modern battlefield.
This initiative, it's not about artificial enhancement. It's about restoring and optimizing your natural capabilities, protecting your longevity, and ensuring you have the biological foundation required to sustain the fight. We owe our warriors the absolute best medical care in the world, and this program delivers on that obligation.
To explore why the American military is looking at testosterone, I want to bring in Sam Cornell, a public health expert from the University of Queensland looking into young men's health. Welcome to the program.
Hi.
This is a really interesting announcement. It follows a trend on social media which encourages men to increase their testosterone levels. What do you make of this now being US military policy? What does the science tell us?
Yeah, I think this is aligned very much with Pete Hegseth's views on what a man should be. It seems as though he is someone that's very much immersed in those corners, those murky corners of social media where, you know, the so-called manosphere exists, where things like this are very much heavily promoted. And it's unfortunate if they're becoming government policy and, you know, that could lead to quite wide-ranging effects on one of America's largest institutions. And it really is just a case of wellness and influencer culture, you know, inadvertently seeping its way into the government.
It's certainly a really kind of contentious policy. What does someone's testosterone levels mean?
Well, testosterone has really wide-ranging functions, particularly, you know, in the male body. Obviously, low testosterone does have clinical effects and health effects. It tends to decrease naturally with age anyway. Most young people really don't have to be concerned about it, don't have to be getting tests of it, and certainly not, you know, young, fit, healthy males who are generally that in the military. You know, you've had to pass a fitness standard just to even be in there. So I think that most of the time it's highly unnecessary. And, you know, when you're testing things, it can lead to overdiagnosis of conditions that actually you don't have. It matters when the test occurs too. So if they're testing, you know, up to 1 million people, up to 1 million servicemen, they're going to find people that their tests show they've got low testosterone, but actually they may not. So it can lead to, you know, that overdiagnosis factor too.
Okay. It is a really fascinating idea, very contentious. Pete Hegseth said in that social media video that the program would also give troops the opportunity to undergo testosterone replacement therapy.
Yeah.
Would that help? I mean, as far as I can see, it wouldn't be mandatory, but they'd be offered it.
Yeah, so the problem with something like testosterone replacement therapy, it absolutely has a place for men that need it for clinical reasons. So, you know, if you've been to your GP with symptoms of low testosterone, things like libido decreasing, erectile dysfunction, your muscle mass decreasing, actual symptoms, and then your GP will test you on at least 2 occasions in the morning to see if you really do have low testosterone. If you start to replace testosterone and you actually have no issues with your testosterone levels, you're in a tricky situation because your body can actually stop producing its natural testosterone and you'll end up requiring it exogenously, potentially for the rest of your life. So, you know, it's not something to just be taking, especially if you've no symptoms. You know, and it's really fascinating that Pete Hegseth has become quite obsessed with this particular hormone, as a lot of the manosphere is. And there is a lot of quack science behind that, and they have views that don't really line up with the evidence, particularly when you're speaking in a military context. And Pete Hegseth seems to think that by increasing testosterone levels across the armed forces, he will therefore improve their lethality, which it really just doesn't hold up on scientific grounds.
It's not clear, unless it was to you, but it wasn't to me, whether women would be tested. What does it mean for women?
I got the impression that they're not really being considered in this, and obviously, Pete Hegseth has a particular view on whose hormones matter. In this regard, testosterone is a predominantly male hormone, if you will, but yeah, of course, it is used in other circumstances by females or people that are transitioning, things like that. But
women do have testosterone as well, right?
Sure, small, yeah, and it's different. That obviously varies by individual as well. Men generally do have more testosterone than females. Yeah.
Yeah. And so, they're kind of silent on that. You study the manosphere and the way this particular trend is really taking off. Just talk to me about this trend. How big a trend is it, particularly among young men?
Yeah. I mean, it is one of those things that's become prominent in the manosphere. There's a real obsession with hormones and virility, and T-maxing became a real phenomenon this last few years. Unfortunately targeting often young males, boys even, who in the vast majority of cases do not need to be concerned about their own testosterone levels. And so it's really making them worry and anxious about because it's tied up with being a man. That's how it's sold on the manosphere. The higher your testosterone levels, the more manly you are, but that just isn't how it works, unfortunately. So it is sad that this is happening, and that it's become this obsession with the biological underpinnings apparently of what it means to be a man, and then that's feeding through even into the higher echelons of the U.S. administration. And as I said, by checking, it can lead to these detrimental effects if you actually end up replacing testosterone when there was no clinical need to do so.